Hey, this is Dr. Chris Goebbels here with Square One, and we're doing the Square One Health Tip of the Week. And this week I'm going to talk about the 7 most common causes of low back pain. So the first most common cause is actually losing the normal curve. You're supposed to have a nice curve in your low back, mid back, and neck, and actually losing that curve and getting a flattening of that curve is one of the most common causes of low back pain. Second one could be having too much curve, or where you get an increased curve, or you see people where they have that big arch here in your low back. So that's another common cause of low back pain. The third most common cause is actually having an anatomical short leg. And if you have one leg that's shorter than the other, what that does is it actually causes your pelvis to tilt. And when you have a tilt, it creates uneven forces or stresses on the lower spine, which can cause things to wear out unevenly, cause things like disc bulges, herniations, things like that. The fourth most common cause is when you have a lateral shift or a lateral translation in your spine, which would be something like this, and it's actually shifted or translated over. Number 5, right along with that, would be actually having a scoliotic curve in your lumbar spine, which is different than a shift, where you actually have a bending and a rotation going on. And adults, the older you get, the more prevalent scoliosis is, and a high percent of people that get chronic low back pain do have scoliosis. The 6th most common cause is having degeneration. So in a normal healthy spine, the bone should be nice and square, and your disc should be nice and thick and even. And when you get degeneration, you start to get these bone spurs, the disc wears out, and it closes off the openings where the nerves come out. Along with, in that category, I would put when someone gets what's called a disc bulge or herniation. And even though, yes, those things are different, for the sake of keeping into our 7 common causes, we're going to keep that in the same category. And the 7th most common cause is something we call the Spondylolisthesis, which is when you have one vertebrae that is actually starting to translate forward or shift forward on the other vertebrae. And it's also a common cause of low back pain, especially down the lowest vertebrae. So as you see, I just went through 7 very different things. Each one of those requires a different treatment to go about correcting those or improving those. And so if you have low back pain out there, if you know someone who has low back pain, and you would like to see if you may have one of these and what specific treatments you should do to correct it, just give us a call and let us know and ask for a free consultation. Because I'm going through this, I hope people should understand that you cannot just do the same treatment for everyone and expect everyone to get better. There's different causes, and based on the specific cause, we need to do very exact and specific treatments to get the absolute best outcome. So Dr. Chris from Square One, giving you the Square One Health Tip of the Week.